Welcome again, friends. So today we will going to discuss about the diagnosis of Mycobacterium tuberculosis. So among diagnosis of Mycobacterium tuberculosis, the main thing that you should know, otherwise the topic will be incomplete, that is the Montu test. Okay, this Montu test is the very important from Mycobacterium tuberculosis diagnosis. They can ask a short note from Montu test. Okay, so what is Montu test? So Montu test, before going to talk about Montu test, I want to talk about hypersensitivity. So hypersensitivity is nothing but a immunological reaction that occur during the secondary exposure of the pathogen. For now you can only remember up to this thing. Okay, and this Montu test is an example of type 4 hypersensitivity reaction. Okay, so there are, and it is also in the class of delayed type hypersensitivity. Okay, so first of all, hypersensitivity can be divided into two parts. One is immediate type hypersensitivity and delayed type hypersensitivity. Under immediate type hypersensitivity there are type 1, type 2 and type 3, and delayed type hypersensitivity includes the type 4. Okay, so why the term delayed? Because after secondary exposure it takes near about 48 to 72 hours to show its symptoms, okay, or show the reaction. Okay, that is why the name delayed type hypersensitivity. Okay, so now we will going to talk about the Montu test. Okay, so Montu test, also known as purified protein derivative intradermal skin test or tuberculin test or simple TB test, is a type of hypersensitivity reaction that we are going to use to find out whether our patient is having any kind of previous exposure to TB or not. Okay, so how we are doing this? First of all, we will apply a intradermal injection of tuberculin to them. Okay, and now I think I don't need to mention what is tuberculin. What is tuberculin? We have talked about in the pathogenicity video of Mycobacterium tuberculosis part 1, where I have told you how macrophage ingest the tuberculosis, and then how Mycobacterium tuberculosis make a good survivable suitable environment for them inside the macrophage. Okay, and there tuberculin play a very important role. And if you want to know about how tuberculin plays its role fantastically to provide a good home inside the macrophage for Mycobacterium tuberculosis, I would like to recommend you to please go and find out the Mycobacterium tuberculosis playlist, and there please watch the Mycobacterium tuberculosis pathogenesis video number 1, then you can understand. Okay, so we are here simply inserting the tuberculin, okay, in between the layers of dermis. Okay, so this tuberculin is obviously the component of the bacteria. So now try to think about this. We have injected the foreign particle, right? Because it is a component of bacteria, that means it is obvious it is not a self component, right? So it is a foreign. So we have inserted them inside the body, right? So what will happen? Our immune system will do something to protect our body from us. That means ultimately we are sending the tuberculin. That is why, in simpler words, that immune system try to protect our body from that foreign particles, right? So now there is an idea that if your immune system has previously experienced the foreign particles earlier, okay, if your immune system has previously experienced that foreign particle, then during the secondary exposure or the second time exposure, the immune system will react very faster than usual, okay, and create a small localized reaction, and it takes near about 48 to 72 hours for this small localized reaction. Now I need to tell you that why it is taking near about 48 to 72 hours to show its action despite it is a secondary exposure. Because I think if you have any basic knowledge of immunology, then I think you know that secondary exposure used to occur very quickly. Then why it takes near about 2 to 3 days? So because the delayed type hypersensitivity or type 4 hypersensitivity reaction is depending on the cell mediated immunity. Remember it. That means it depends on the T cells. Okay, and that is why it takes near about 48 to 72 hours. Okay, if it includes humoral immunity, then surely it will take very much less time to show its reaction as compared to this one. Okay, so upon injection of tuberculin, there will be a small localized reaction within 48 to 72 hours. Okay, if you are a TB positive patient, for example, let's say, still you will develop small localized reaction, and again if you are a negative Mycobacterium tuberculosis person, then also you will develop a small localized reaction. So what is the difference? Why we are performing this kind of test? So the difference is if the patient is Mycobacterium tuberculosis positive, then as a result of this small localized reaction, he will develop or she will develop a large enough area of induration. Okay, that will be greater than or equal to 10 millimeter in diameter. Okay, and if your patient is Mycobacterium tuberculosis negative, then he or she will develop just a small redness. Okay, so if your patient having a large area of induration which is greater than 10 millimeter, then it will be considered as a positive test. Okay, so here I will use a picture from Ministry of Health that I have downloaded from internet. You can also consult this. I will put the link of that thing in the description box. That is how Montu test is done. Okay, as you can see here, PPD, that is purified protein derivative, which is nothing but tuberculin, is injected in between layers of the dermis, and then after 2 days there will be a large induration. Okay, if the diameter is greater than or equal to 10 millimeter, then under such circumstances you can say that yes, your person is TB positive. Okay, that does not mean, as you can see here, a measurement is going on that whether the induration is in the, try to say us that whether the person is Mycobacterium tuberculosis positive or not. Okay, so I hope you have understood the concept of purified protein derivative intradermal skin test or Montu test very well. That here we are simply inserting the tuberculin in the intradermal by the intradermal injection. Okay, and inside the body tuberculin creates a small localized reaction, and if your patient have experienced previous exposure of TB, then it will create a large greater area of induration. Okay, and if it is a first time exposure, then he or she will develop just a small redness. Okay, so this is the thing for Montu test, but there is a problem in Montu test, that Montu test does not tell you that whether the infection is active or latent. Okay, that is the problem of Montu test. So we have to consider another important test is for finding out whether the infection is active or latent. Otherwise, whether your person have previously faced tuberculosis or not, for knowing this, Montu test is very useful. Okay. Now let's talk about another kind of test, that is interferon gamma release assay. Okay, so this interferon gamma release assay looks for the previous exposure of TB protein in the blood. Okay, so interferon gamma release assay is an experiment which try to find out the evidence of previous exposure of TB protein in the blood. Okay, so there is an advantage that since this one is a blood test, one does not need to show up again to have the test read like in case of TB. Okay, because after some time your induration will be disappeared, and then you have to again perform the test to make you to give a positive report or negative report, right? But in case of interferon gamma release assay, you do not have to do it, right? Because it is a blood test. Okay, and also this is sensitive to only Mycobacterium tuberculosis. Okay, it shows specific type of special sensitivity to Mycobacterium tuberculosis, so that is quite useful, right? And most surprisingly, it does not give you positive result just because of that you have taken BCG vaccine. Okay, so what is BCG vaccine? So BCG vaccine is nothing but vaccine that protect us from tuberculosis. So interferon gamma release assay does not provide any positive result just because of previous exposure of BCG vaccine, but tuberculin will surely give a positive result for BCG vaccine. Because what is vaccine? Vaccine is nothing but here we are providing the particles that will create a immunogenicity, right? So that is nothing but most of the cases bacteria itself in its inactivated form, right? So it becomes very difficult to understand whether the induration is due to the BCG vaccine or whether the patient has Mycobacterium tuberculosis in his or her body in reality. Okay, so that is a very important thing. That is why interferon gamma release assay is more preferable than your PPD. So, and we are using this BCG vaccine for treating many children to prevent disseminated TB, that is our systematic miliary TB we have talked about, right? So although it also contains the same problem, that it does not told you whether the disease is active or latent. Okay, so for finding out whether the disease is active or latent, if you have get the result positive for either PPD or interferon gamma release assay, please go for a chest X-ray. Okay, this chest X-ray will told you whether your chest is having sign and symptoms of active TB disease or not. Along with that, if you have a patient with fever, night sweat, coughing up, weight loss, blood, that is hemoptysis, then take the sample of sputum or bronchoalveolar lavage, that is you have to take up the sample from the lungs, and for this you use a bronchoscope to insert it through the mouth or nose into the lungs. Okay, and then you will collect the fluid. Okay, and now this fluid sample will be sent to the laboratory for either staining, because we can stain Mycobacterium tuberculosis by Ziehl-Neelsen stain. We can culture them, right, and we can also use the PCR technique to took for the evidence of the Mycobacterium tuberculosis. Okay, so that is the various type of diagnostic method available to detect whether a person is infected with Mycobacterium tuberculosis or not. First one is purified protein derivative, where positive result means a large greater induration of 10 millimeter in diameter, right, and negative result will simply show redness. Okay, and in interferon gamma release assay, the main advantage is it will provide you sensitivity towards Mycobacterium tuberculosis, and it is a blood test which looks for previous exposure of TB protein. Okay, and if your patient also having symptoms like fever, like coughing, like night sweats, like blood, that is hemoptysis, you can perform bronchoalveolar lavage, or you can take the sample from the sputum and transfer to the laboratory for PCR culturing and staining technique to find out Mycobacterium tuberculosis is present or not. Okay, so that is the diagnosis part of Mycobacterium tuberculosis. So I hope this video will be helpful to you. Now in the last video we will going to talk about the treatment of Mycobacterium tuberculosis, and that will going to be very important one, because there are various kind of treatment available for Mycobacterium tuberculosis. Okay, and we will also going to talk about the DOT, that is directly observed therapy, recommended by WHO specially for Mycobacterium tuberculosis. Okay, so thank you for listening to this class.